Hello and welcome to The Authentic Physician. I'm here today with Dr. Rebecca Thompson, and she has a really beautiful story to share with us. I'm Dr. Amy Loden Tiffany, and I created this podcast to help create trust in medicine again and really talk about what went wrong, what's going right, and where can we move forward together in making the world healthier and healing really deeply hurt areas that historically are not always addressed. So, welcome to the show, Dr. Thompson. I'm glad you're here.
Thank you. Thanks for this opportunity, and it's great to connect with you.
Thank you. When I first learned about some of the work you're doing, it was actually through one of our colleagues, and she had recommended us to connect. And one of the things that I thought was really powerful as I got to know more about you is that you have worn both the physician hat and the patient hat, and
Mhm.
you've chosen to be really vulnerable in some of the ways that you've shared those lived experiences in both hats. So, why don't we start there? Tell us, what is the book about and why did you feel compelled to share it?
Thank you. And that's exactly why I was so excited to connect with you as we share that becoming a patient and how much it has shaped our practices and our views on life. Um, Looking back, so when I was first finishing up my training residency program and starting out on my first attending level job, that was when my husband and I decided it's a pretty good time to think about starting a family. It's when a lot of us do, given balancing careers and family life. And very quickly, we went through a string of really intense pregnancy complications,
Mm,
including two losses that were life threatening to me, all in the span of less than a year. Actually, fittingly, it was exactly 9 months,
mm,
kind of poetically. And it was incredibly overwhelming and incredibly isolating, even as a person who had a fantastic partner, supportive friends, extended family, and even as a physician who understood the system. Right. So I was used to helping other people navigate it. I had a professional network I could lean on. This is just like you described in your TEDx talk. When all of a sudden, I've become the patient,
mhm.
and I'm taking care now. I'm doing the things I used to take care of people for,
Right.
but I still didn't know. In spite of all this privilege and this education, this knowledge, I didn't know how to make sense of what was happening to me, and I was hesitant to share and be vulnerable. But once I gradually did and started to share more and open up about it. And at the same time as I was finding my way through these struggles and past them, so many of the women, the families around me, they would start to share their own stories. And these little glimmers, I just realized, I think I knew already, but it was a tangible reminder that everybody has a story. And in many cases, these were stories, whether it was my patient, my friend, even if she didn't know my story, there was a sense that we could trust each other,
Mhm.
and stories started coming out that maybe they had never told anyone else. And it really felt like it brought a little bit of healing to both of us. So that's the origin of this book. And I should say, I guess we should. The title of the book is "Held Together: A Shared Memoir of Motherhood, Medicine, and Imperfect Love." And this is the culmination of sharing those stories. I'm not happy to get into more detail about it, but
Yeah.
that's all the inspiration behind it is that experience and that realization when I started to open up about how powerful that was.
Mhm. And I want to come back to that, but one of the things you said resonated really deeply with me. It was this idea that you and your patient could trust each other.
Yes.
And I'm going to go way outside this conversation for a second, 10,000-foot view. In your medical school training, in
Mhm.
your residency, do you remember feeling supported in this idea that you should not only be a place of trust for your patient, but that you should reciprocate that and that together you would grow forward? Because I don't remember that in medical school.
Mm. I think that's something that's really important to think about
Yeah.
how we shape
Mhm.
training, how we influence the next generation of healers and hope we can bring that.
Right.
I don't really remember that.
Right.
You know, I feel like I had some fantastic individual teachers, professors,
Mhm.
mentors, and
Mhm.
a lot of them, I think, would stand behind that. And we're trying. There was
Yes.
there was definitely a beginning, a rumbling of a movement
Mhm.
toward humanism in medicine, narrative
Yes.
medicine that had begun a bit
Mhm.
back then when I was starting med school out in the late 90s.
Mhm.
But I don't feel like it really was embodied in the culture of the train.
Yes.
And I I think that looking back, when I had that instinct, even if I couldn't have articulated back then, of wanting to practice or learn to practice that way,
Right.
I do remember specific examples of
Mhm.
being kinda shut down in trying to do
Yeah.
that and being kinda scolded for that's not
Yes.
I remember examples of being told, "Well, do you wanna be a doctor or do you wanna be a social worker?" As if
Right.
that's a negative thing, like, that seems like a
Correct.
thing,
Yeah.
but, why are you trying to really develop this relationship with your patient?
Mhm.
There's no time for that in this context.
Right.
It was very unsettling. It
Yes.
sticks with me, what is this now, 25 years later.
Yeah. Yeah. I would share that
Yeah, how
even though
about
they're
you?
yeah,
Yeah,
most I
yeah.
wouldn't say that anyone ever came out and said, "Don't do it."
Mhm.
But it was like, you gotta get through the rounds, you gotta
Yeah,
get the notes written, you gotta get the patient's prescriptions sent, tucked in, and then you gotta get out of here because you have to be out of the hospital at a certain time. I mean,
yeah.
there wasn't that relationship building, and my first year in residency, the very first patient I had who died,
Mhm.
I was quite traumatized because there was
Yeah,
no
yeah.
debriefing of that, and there hadn't
Mm,
been in med school either, but as a resident, I needed that,
mhm,
and I ended up going to his funeral,
mhm,
which is very unusual, I think, and I certainly haven't done it for every patient that's died since then,
mhm.
but for me, there was a closure need there, and I didn't feel like
Yeah.
the system supported me well in the grieving the loss of a patient,
Mm,
which was a violation I now see as a violation of my trust in it.
mhm,
And I think that was just the very beginning of dissatisfaction that I had, as a healer within a system that's broken.
yeah.
And to be clear, I'm not calling out anyone and saying they were wrong or bad or inept. Yes, we're all
Mm,
struggling and doing the best we can. But as I look back and reflect, I think that was one of the first times that it just the alignment was missed
yeah, I
as a
see.
physician. And of course,
Mhm,
wearing a patient hat, we can have similar.
mhm,
I think anyone in healthcare who's been a patient and worked on the healthcare
mhm.
side feels that disconnect.
Yeah, that's the issue, the alignment, the disconnect, like, where are we don't all have to practice in the same way. People can
Correct.
find what they need in a physician, if
Yes.
the physician or the privilege of being able to shop around, and if there are
Mhm.
enough resources in their community, that's a whole separate.
Right.
But assuming
Correct.
they have the option of, choosing their
Mhm.
person, we can have different styles. But
Correct.
and the style that we want to practice that we think really brings our value to
Mhm.
that clinical encounter, and we're not able to access
Yes.
it, that's the challenge, right?
Mhm. Let me describe a second situation I developed or I experienced, which continued to
Mhm.
develop this distrust within me. And I'm curious if you've
Mhm.
experienced something similar.
Mhm.
One of my employers once told me, he said, Amy, you find these most interesting diagnoses in these patients. Like you're finding amazing things. And that's great. But, and you always know when the but is, there's something wrong. He's like,
Mhm.
you're finding problems because you're looking for problems.
Mm.
And at a fundamental level, I was like, what else would I be doing? Right?
Mhm.
But
Mhm.
every time you order a test, the idea is there's cost to that. And the truth is, if we look at all the economics, it's not exactly portrayed correctly. The
Mhm.
math doesn't always math. But I'm curious, like, have you had an experience like that where you felt like you were genuinely doing the right thing and somebody within the system, can we say scolded you for taking the best care of the
Mhm.
patient you could? Um, because to me, that did feel like a trust violation of you should be encouraging me
Yeah.
to do this, not discouraging me.
Yeah. It's interesting, you bring it up in the context of testing and sort of implying the financial resources, and that's part of
Mhm.
it. I've always been really mindful, especially when I was in a really intense full-time clinical practice, which I'm
Mhm.
not in right now, but
Yeah.
in those days of just the constant stream of evaluations
Yes.
and treatments, I've always been really mindful to only run tests that would truly change how I would care for
Mhm.
the patient, what
Yes.
next course of action would be.
Yes.
So I do think about that a lot, but in terms of sort of being scolded. I think that's a good way to capture it.
Right.
Being scolded for practicing a certain way. I think it's the same idea as the social worker versus
Mhm.
doctor role because
Yeah.
to me it's about the time resource
Mhm.
and how much time are we allowed to allocate
Mhm.
to any one encounter. How is our schedule set up?
Yes.
How does the flow of our clinic or our hospital rounds, whatever the
Mhm.
context, how does it support or discourage what we're hoping
Yes.
to do? And I do feel like, well, the example I gave earlier, that was on kind of in a pediatrics
Mhm.
inpatient setting. That's the
Mhm.
most prominent example that speaks exactly to what you said. But I also feel like the system as a whole felt scolding for that,
Yes.
bring training in early attending years.
Yes.
Um, and so I think that, truly working on a project like this is kind of my reaction to that
Mhm. Yeah.
because I've loved the clinical medicine that I've done in so many ways. I've had
Mhm.
a ton of frustrations with it, of course. That's why I'm not currently working 60 hours a week in a clinical setting.
Yes.
Um,
Yes.
but there are so many parts of it that I've loved and that connection with patients and some amazing colleagues and learning from each other.
Mhm.
Um, but ultimately, I think what I realized is that I did want that role where I got to sit and listen.
Mhm.
And I did want the listening to inform the care and people to feel actually cared for and actually
Yeah.
cared about and not just
Yes.
given medical care
Right.
in name only.
Yes.
So, I think of as I've been so fortunate to have time to prioritize
Mhm.
looking at people's stories, thinking about them with them, and creating these narratives to
Mhm.
write and to publish and put out in the world. I think of the comparison between when I'm in clinic, I've been able to see one patient, one family for this short time and at intervals in their lives
Mhm.
can be really rewarding. These individual interactions and influences we can have on their lives, hopefully, mostly for the good.
Right.
But that's one person, one
Mhm.
family.
Right.
When I can gather stories like these and find the bigger meanings and see the threads that weave between them, I
Yes.
feel like I'm able to move into this level of population health.
Mm.
And the parallel becomes, we're caring for people by helping them make sense of their narratives in clinic,
Yeah.
whether the narrative includes data,
Right.
testing, and their stories and all these things. Now we've moved it instead into we're really using their perspectives and their stories and their memories to make the context, to build that context and understand their lives.
Yeah.
Yeah.
I love that. So I'm going to try to remember both questions I have for you. So,
Okay.
right, my perimenopause brain, forgive me.
Right.
But one of them is you use the term population health. And I
Mhm.
love that you use that because that's not typically the context we hear the term in. At least in my world of internal medicine, now when I hear population health, it's are their blood pressures at goal,
Right.
glucose, are the lab tests for have they been sent to
Right.
the podiatrist and all the
Right.
things. So that's I think what most of our healthcare listeners might hear with that
Mhm.
term. I don't think that's how you meant it though.
Mhm.
You
Yeah.
wanna
Well, I
speak on
have a,
that at
a
all?
bit of, sure. I have a bias. I also have a master's in clinical epidemiology. So I think one of the most rewarding things to me in medicine has always been to see patterns. So when I think about population health, and I my initial residency and boarding was in public health, preventive
Mhm,
medicine and public health.
mhm.
My second residency was in family medicine, which you learn about in the book.
Yes.
And I went back to do that to focus more on women's and children's health. And that's
Mhm.
really the crux of the story here. But going back and thinking about that epi background and that epi bias, um,
Yes.
I feel like it's learning about the connections between the stories and
Mhm,
that it's partly the perspective that I've gained through that kind of study and thinking
mhm.
about things from the epidemiological perspective and the population level. But to me, I love seeing the patterns. I
Okay.
love hearing stories from 5 different women,
Mhm.
say, and in this book there it's my story, my family's story of our complications in building our family, and woven in are the stories of 21 other women from my practice, friends, medical coworkers. Um, I love hearing, let's say, 5 of these stories that sound like they have nothing in common on the surface,
Mhm.
but when you really explore them with each person, with each woman, you see the universal threads.
Yes.
And that's what I mean by population level. You see
Yes.
that we have so much more in common, both in our perspectives and our stories and just in our lives, than
Mhm.
we do that's different. And
Yes.
everyone is going through something. It's just the details that matter.
Right. That's really beautifully said. Thank you.
Yeah.
I thought there was probably more,
Yeah.
to it, so thank you for elucidating that.
Well, thanks for asking.
Before I go to my second question, I want you to actually tell our listeners if they wanna pick up a copy of your book, where can they get that?
Sure, sure. Everything is on my website. So, I mean, you can get it anywhere you buy books. It's published by HarperCollins, so it's easy to find. At any bookstore can order it, and please support indie bookstores if you can, or the usual spots you can order it online. I will say, my website is just my full name with the initial, so RebeccaNThompson.com. And there is a link there. There are several links there that you could use to order it to benefit Postpartum Support International, PSI, which is a maternal and family mental health organization that does fantastic work. So if you're willing and able to go order through one of those affiliate links, I put them on my website on the order page, hoping we can raise some funds for them.
Mm,
Um, and or there are ways to order signed copies from my local bookstore that can be shipped anywhere in the US. So thank you for asking.
love
Please get
that.
and there's an audiobook too, and a Kindle
Yes.
and all the things. Audiobooks are great for busy parents. But yeah, great if you can
Yeah.
order through one of the places to benefit an organization beyond
Yes.
just this project.
Perfect, and we'll bring it up again at the end, but just in case
Yeah.
listeners have to hop off, I want them to know where they can do
Yeah,
that
thank
and
you.
how they can join you in helping the bigger community.
Mhm.
Okay, so my other question, this is kind of circling back to something you made a comment about a few minutes ago, and it's what I've always
Mhm.
heard, and I'm going to, if I can, just gently push on this and see where we
Mhm.
go.
Mhm.
The comment I've always been told is exactly what you said, "Don't order it if it don't change management," right?
Mhm.
So
Mhm.
we're gonna hold that in this column here, and second next to it, the silo I wanna offer is patience don't always care if it changes management. And is it a violation of trust if patients feel like we're not willing to meet them where they are? And I realize some tests we shouldn't run at all. Other tests, there's a lot of gray. So not even getting into all that, but just when a patient's coming and they're saying, I really think I need this test. Are we doing them justice to tell them no and then they get it somewhere else? Are
Mhm.
we decreasing trust in that process? That's exactly how I was trained, was what you said.
Mhm. Mhm.
But I struggle with that because I have too many people who are like, why? They still don't understand
Mhm.
despite what we
Yeah.
say.
No, really well put. I think my immediate reaction to your question is, well, those aren't mutually exclusive. Right.
Right.
So I think it's about how we define management or how we
Hmm.
define what we're so declining to run a test for someone who feels like it's really, really important to them,
Hmm. Yes.
there's a cost to that, right?
Hmm.
There's a result that comes from that.
Yes.
So that's where the balance is, where the art of medicine comes in.
Hmm.
So I'm saying, if X, then this changes your reaction in this Y way,
Hmm.
right?
Yes.
Part of the change in the therapeutic relationship is the decision that you make together with the patient, with your patient, with that
Right.
person, patients
Right.
being people, with
Yes.
that person about what you're going to do together. And
Mhm.
that's where having the trust is, I mean, it's not a given, but a
Yeah.
hoped for thing, right? The trust in your relationship. So if you, and this is a time factor, if you can have
Mhm.
that conversation
Right.
where you understand why they're
Mhm.
asking for it. And
Yes.
I don't know, are you trying, every situation is different. Is it something
Mhm.
that you're trying to convince them this is not a good use of your time and money, you
Right.
as a patient, or
Yes.
that's the system issue?
Mhm.
As long as they are fully aware
Mhm.
that in our society, the issue insurance might not cover it, whatever it might be, they may have to pay
Yeah.
for it out of pocket. It may not change what we do next, but it
Right.
does change your relationship with them.
Yes.
So I would argue that it's not a blanket statement to say, we don't run this blood test because it doesn't change your medication that we're giving
Mhm.
you. That's not
Right.
what I mean. I mean, we don't run this whole panel of everything without thinking about it
Yes.
because that doesn't meaningfully inform what we
Mhm.
do together next.
Right. I love that you're focusing on the together part. I've heard you say that several times in this answer, and that's why I wanted to push a little bit because I do
Mhm.
think that in 15 or 10-minute blocks, most physicians do not have the time to have a
Agree.
conversation that question may deserve.
Absolutely agree.
And in my lived experience of practicing as a physician, there's been a lot of times that somebody asks for something, and I
Mhm.
know it's not going to change what we do, but
Mhm.
it's gonna cause them so much emotional pain and
Right,
anxiety, and
right, so
it's
that's
gonna
change. It's a real
right? Right? And
yeah.
so, like, if it gives somebody a better quality of life
Yep.
and it costs $50, do
Mhm.
I really care that much that it costs $50? Or am I giving them
Mhm.
a bigger gift
Yeah,
and showing them that they're not crazy? It's
yeah,
not all in
you're
their
getting
head.
something for that money.
Correct.
It's not just about the test, you're getting
That's
more
right.
test for that money.
Yes, yes, and so I've seen that so many times, and I imagine in your world you
Mhm.
have too.
Mhm.
On the patient side, it's fascinating to me. A test I asked for, and I love our pediatrics clinic. They are
Mhm.
fantastic. And the doctor kind of said that same thing to me. He's like, "Well, it's not really going to change what we do." And I'm like, "I get
Mhm.
that, but it's causing me a ton of anxiety to not
Mhm.
know. And it doesn't change anything except to keep it as proof that this may, in the long term, be
Yeah.
something to
I
reference."
think it does, and you're alluding also to the fact that it can be a baseline, and that really
Yes.
can change something. Like,
Yes.
that does go to the literal changing of the
Mhm.
action, because if you know this later and you get a different result that shows you that it's still officially normal,
Right.
we look at people and say, "Oh, sure," your example,
Yes.
"You had gestational diabetes, but now you're
Yeah,
fine. Everything's normal.
exactly.
What are you worried about?" No,
Right.
I have data that
Yes.
that say I should be worried about this, and here's why.
Correct.
To
Yes.
I mean, I'm so
Yeah.
prevention minded like you,
Right.
so
Yeah. No,
we're
I
bot
I I love that, that you're bringing that out, and it's tough because I don't know exactly how the saying goes, but the idea is you can't always quantify fiscally what you
Mhm.
can't measure because it didn't happen,
Right.
right?
Yeah, exactly.
And so there is that kind of trade-off, and
Mhm.
the way I think of it often is what will I regret less,
Yeah.
right? And, both
Mhm.
in my physician hat and in my patient hat,
Mhm.
and we've all had different experiences, but when it comes to trust,
Mhm.
I think that's a bigger theme than perhaps we're hearing about in
Mhm.
our training. And we may not
Yeah.
have the opportunity to witness someone as an attending physician or a supervising physician during our training who knows how to handle that really well.
Mhm.
And because of that, creates generations of people,
Yeah.
physicians not handling it well, and yet they're not meaning it maliciously. They're not
Right.
trying to destroy
Right.
something or be hard. So when I trained in New York City, and
Mhm.
of course, Lyme's disease we all think of
Mhm.
as being kind of an East Coast, Maine, Connecticut type of
Mhm.
problem, right? I now live in St. Louis, Missouri, and I have a
Mhm.
lot of patients who come in and tell me they have Lyme disease, chronic
Mhm.
Lyme, or some other iteration of that, and it doesn't add trust in their story for me to tell them epidemiology.
Right.
Right, and so that's another example that I see quite often.
Mhm.
Are there any examples that are coming up for you as we're talking that you're just like, "This is a real thing that I've heard," or
Mm,
wanna comment on? No? Then can I ask you one? Can I poke a little bit?
yeah, I'm just thinking so much about your example. I'm
Yeah.
having trouble moving into my own example, because I think the the whole paradigm about diseases that we can't see and we
Mhm.
can't measure well.
Yes.
So I could probably come up with my own examples, but yours is just such a perfect one that I'm mired in that for now.
You
You
can
know,
stay here, that's fine too.
how do we help people understand their stories, understand their situations when we really can't always measure them with these tools?
Mhm.
They come to medicine
Yes.
as a practice,
Mhm.
hoping for answers,
Yes.
seeking answers. And we want to be able to give them answers because that's
Correct.
what we've been trained in.
Yes.
Asking a question, whether through a test or through an interview, and figuring out an answer.
Yes.
And when the people that we work with have symptoms or experiences or worldviews that don't lend themselves to neat, easy answers.
Mhm.
It's really it could be it's very tempting, I should say, to think, well, maybe that's not really what's going on. Maybe that's not what's happening here. You say in St. Louis, we don't really have that
Yeah,
epidemiologically. That makes sense.
right.
Does that really matter exactly what we call it?
Mhm.
Or can we get at the core of tell me your experience? We can
Yes.
we can name it what you need to name it, and
Right.
it's tricky because we have to land on some diagnoses for
Correct.
medical reasons.
Yes.
Um, but the more important thing being, why is this
Yeah.
what you think is happening?
Mhm.
You as the patient, why is it important to you to name it this?
Yes.
Where did you come to the idea, whether it
Right.
seems medically valid to us or not as the physician?
Correct. Yes.
So it's just a really interesting thing to explore with
Eh,
meaning of illness. With again with my
correct.
bias in epidemiology, and I was also an anthropology major in college, so I
Oh,
just
how
go
fun.
down that hole into that
Yes.
hole.
Yes. No, that's great. And I think I've had a recent conversation with someone. It's probably why it's on my mind so much.
Yeah.
And I think this is where it goes back to the trust in the medical profession too, because this person had seen a functional medicine person who was an MD. They
Mhm,
had seen a chiropractic physician.
mhm,
They had seen a naturopathic physician.
mhm.
And so there's competing tensions here,
Mm,
and there's competing
mhm,
stories based on
mhm.
how each profession acknowledges and leverages or de-escalates the validity
Right,
of certain tests.
right.
So
Mm,
I struggle. Like I don't.
mhm,
These are incredibly intelligent people, or they wouldn't be doing what they're doing.
mhm.
I don't want to in any way say that they're not coming at this from the best of intentions. And yet I'm still having a conversation with someone who has symptoms, who
Mm,
isn't feeling heard, who feels
yeah.
like they've been dismissed by the medical profession, the traditional medical profession.
Mhm.
So yeah, any thoughts or reflections
Yeah,
on those added thoughts?
yeah, we don't have I think we get overconfident in medicine. We don't have a test for everything,
Right. Right.
right? And just because we can't quantify something doesn't mean it's not real.
Correct. Yes.
So I guess while we wait for the technology to advance, that's
Yes.
really where
Yeah.
the healing power of stories can come in
Mhm.
and feeling like we're giving people the space
Yes.
to be heard, be understood. And I mean, it sounds cliche when we try to generalize it, but
Yeah.
it really comes back to that idea of, I know a lot of your current practice is about breaking old health patterns
Mhm.
and trying to create better habits and better, not just actions, but like thought patterns.
Yes.
And what
Correct.
that brings to mind for me is how we make meaning of our stories.
Yes.
So, whatever we want to call our symptoms, our
Mhm.
experiences medically, right? How do we make sense of the constellation of things that happens to any one of us in a body, right?
Yes.
And then given that we can really we can't choose everything that happens to us,
Mhm.
but we really can choose what we take from it.
Mhm.
And I think there's a big distinction between finding meaning in something, which is the implication that everything happens for a reason. I'm just going to
Mhm.
find the purpose, find the
Mhm.
meaning,
Yeah.
and choosing to create meaning.
Mhm.
And so, with your example of your patient that, can't quite get the diagnosis pinned down and it's frustrating for them, it's frustrating for you because you want to help them more.
Right.
It's taking a step back. Okay, whatever we would call this, how
Mhm.
is it impacting you?
Yeah.
How does it shape your perception of yourself and how you live your days? And on a practical level, how can we help you be oversimplified to say like be empowered by it, but how can we
Yeah.
help you have some agency over
Mhm.
it
Yes.
in order to recognize the challenging parts, but like what can you still do?
Mhm.
What can you
Right.
use this for?
Mhm.
I don't know.
And maybe even what can you do more now because it's different
Yeah.
versus a loss, but thinking of it as a gain. What can you do that you wouldn't have done before,
Mhm.
right?
Yeah. Yeah. What
Um,
are the new opportunities? What are the I mean, it's so tempting to do that too, but it's tricky. You don't want to it's oversimplifying. It feels Pollyanna to just say, "Oh, it's
Right.
we're gonna make the best of it."
Yeah.
No, that can
Right.
be a very bad
That can be very
strategy.
harmful.
Very
Yeah. I mean,
harmful and like a blaming the victim kind of a thing, right?
right.
Uh, or if you're not pulling yourself up enough on
Yeah.
your own, then you're the one
Mhm.
who just can't do it and everyone else
Yeah.
is stronger. So
Yeah.
it's a very slippery slope, but
Absolutely.
as much as we can empower people by
Mhm.
helping them understand
Yes.
the meanings, their stories, and again,
Right.
choosing the meanings, making the
Mhm.
meanings, not just finding them because they happen
Right.
to be easy to
Yeah.
access. They're not easy.
And there may not be something to be found. It may
Mhm.
truly have to be created.
Has to be usually, I think that's more
Yeah.
often the case than not.
Mhm.
Yeah.
And so, pivoting back to your book, thinking about these created meanings,
Mhm.
and as you think about all the different conversations that went into this work, and did you tell me, did
Yeah.
I understand correctly, it was a process really for you over several years to create
Yeah.
this? Okay.
Actually just over 10 years.
Wow. That's a
Yeah,
lot
so
of wisdom.
it and not just for me. Thank you,
Mhm.
and I'll take that compliment on behalf of all
Please do. Yeah.
21 of the other women because I just I can't say enough. Literally, I couldn't have written this without them, right? It's a true collaboration, and
Yes.
the way that we did this was I really wanted to help these people find the best version, and I'll say create the
Mhm.
best version
Yeah.
of their story that they possibly could, the most compelling, the most insightful.
Yes.
And that didn't just mean, oh, why don't you go jot something down and give it to me and I'll lightly edit it. This book is not an anthology. What
Yes.
it is a project of collaboration in which each woman, so these are all people that I know from my life. Some of them have been my patients, some have been medical colleagues at different jobs and training programs. Some are just friends I've known for 30 plus years. Some of them have been all three of those things at different points in each other's lives.
Yes.
And so for all of them, I just invited them, here's my idea. I want to create this kind of collaborative storytelling project that talks about how complicated family life can be. It's not
Yes.
just about early years. This is not a book of birth stories.
Right.
It's not a book about fertility. It has some of those elements, but it's about what does family mean and how do we all become and be in, parts of a family. And so I approached each of them, proposed this idea. They all were excited about it, and just some hesitant, like me. My story is not interesting enough. I got a lot of that. Trust
Mhm.
me, it is, and we can find the threads in it. Uh,
Yes.
and they were just all so gracious to spend hours and hours and hours talking to me. Each one of them, I would say any given story took several years minimum, and the whole
Mhm.
project was just over a decade.
Mhm.
So we would do oral interviews, record them. I would transcribe that, listen and pull out sections. And essentially, for each person, and some of them gave me journal entries or like emails they'd written to friends and family during moments of crisis, describing, updating what has been happening. I took everything they could give me and I sort of used her words as
Mhm.
much as I could to write a first person account, her
Mhm.
point of view of
Yeah.
her story, gave it back to her. Say,
Mhm.
okay, here's what I see from what you're telling me.
Yes.
How did I do? Like, what did I get wrong? What would you add? What would you change in this
Yes.
part where this happened to you? Can you
Mhm.
expand on that? Can you tell
Mhm.
me more about what you were feeling? And so to really work closely with each person to shepherd her story and just together make it the most immersive experience that the reader could have. And so
Yes.
that was our approach.
And what I really love about that, because it's a unique way to do this.
I
Many
think so. I
people,
haven't
right?
found I'd love to read more, so please others keep doing
Yeah.
it, but I haven't found others.
No, I don't know that I've seen a lot of others either. At least not in the shared experience of physician
Right.
hat, patient hat. Like I've seen different
Right.
collaborators, of course, but
Right.
and on top of that, in a topic that is very personal, very
Mhm.
vulnerable,
Mhm.
very fragile,
Mhm.
and
Yeah.
open opening up to the world,
Mhm.
right? In
Mhm.
something that is so close to heart. So
Yes.
I think that itself adds to the trust that anyone could
Mhm.
have in these stories and in yourself and
Right.
so forth. And most of us probably wouldn't be willing to do something like that. Um,
Mm.
or would need a lot of help, handholding, and encouragement, right? I mean, I just think of myself if somebody had come and asked me that, and you're right, I did the TEDx talk, and I've written my own book, and it's kind of like, you put yourself out there, but there's something different about doing it with someone else
Yeah,
versus owning it yourself, and so that took a lot of
true.
trust between you and the other collaborators, and
Yeah, and I'm grateful for it. I recognize it. I mean, I do say that I feel like this book is just a testament to persistence and patience and trust.
yes, yes,
And
absolutely.
I so appreciate their willingness to go on this this
Yeah.
adventure with me.
Well, and I love that you're trying to create the opportunity for it to give back even more, right? Because being
Mhm,
able to invest in this postpartum initiative and help,
mhm, mhm,
uh, I just don't know that we see that all the time. And so,
mhm.
actions for whether we like the adage or not, actions do speak loudly, right? And
Yeah.
so, your actions are all aligning with this idea of, I do want to help
Mhm,
the bigger picture and the
mhm,
greater public, and we want to
mhm,
leave a legacy here.
mhm.
Um, as you think about the work you've done so far and where you wanna go in the future, and maybe you're not quite there yet, but are there certain things that you really wish you'd maybe leaned into more, through the process or would do differently? Or are you 100% happy with how you did it?
So far, so good.
I love that.
I mean, I will say that I don't really feel the need to think about sort of what's next or regretting what I've done because I feel like I'm in the thick of it. The book, it
Yes.
came out in April. So as
Mhm.
of right now, that's, a few months ago, 6 months ago or so, just over. And in the book world, that's like, okay, your book is all done. Like move on to the
Mhm.
next thing, right?
Right.
But that's not how I'm approaching it. And I'm comfortable with being unconventional in that way. But there are books that I've loved for decades. I want
Mhm.
this book to stick around. And
Yes.
I wrote it really intentionally to be very evergreen. There
Mhm.
are no references to pop culture type things or
Yes.
there are very few sort of names. It's only the
Mhm.
very essential people in each chapter who are named. You never know the names of the other doctors or it's meant to feel very universal and very
Mhm.
evergreen. You can just jump
Yes.
in and feel like you're part of that story.
Mhm.
And so I I will talk about this book and
Mhm.
spread the word about it for as long as anybody will listen.
Yes.
As we were mentioning earlier, kind of the culture of medicine, the
Mhm.
training, I very much wish to get this into any medical school, nursing program, doula training,
Mhm.
lactation training, midwifery, social work, psychology, anything
Yes.
like pharmacy, anything you can think of.
Mhm.
I feel like these stories are the kinds of things that the next generation of healing and serving and helping professionals should read.
Yes. Yes.
And so that's kind of what I've begun. Now that the initial big book launch is settling a little, I'm still doing lots of events and podcasts and
Mhm.
things, but I have a moment to regroup and I've been starting to reach out to some of the medical schools
Mhm.
both locally, I'm in Oregon, so locally out here and virtually all over the country and start to plan some programs with them. So
Oh, I
that's
love that.
truly the next thing. And I mean, I will do this is the most rewarding thing I've ever done
Yes.
clinical medicine has such rewarding moments, the
Right.
glimmers are in there, but
Mhm.
this is my life's work,
Yep.
and I don't think I'll ever get tired of it, so I don't feel any concern about, "Oh, I missed this opportunity," or I mean, of course, there are always things like, "Oh, I wish I could get in on
Yeah.
this even faster. I can't do all the things at once. There are so many
Right.
good things." Um,
Yes.
but I don't have any regrets. I'm just, like,
Yeah.
moving forward all the time.
I love that.
I'm
Eh,
excited for
well, and I can see you just light up about it.
it.
It's obviously beyond just something that you did to check a
Thanks.
box.
Oh,
It's,
for sure, and,
a
the
value.
reason I think it also comes back to what is at the core of these stories?
Mhm.
And again, I'm going to go to reference your work too, because I think this is what we share. So you say, I think the main message from your TEDx talk is that pregnancy is about more than the birth of the child.
Correct.
And the reason that family stories are so central to our lives is that they are our identities,
Mhm.
right? When we are pregnant or adopt a new child into our family, foster, our who we are changes every time. The
Mhm.
mother is born too, right?
Yes.
Parent is born. And that's why, you know, why our work is so resonant, yours and mine,
Mhm.
and why the story isn't held together, why it was so intentional to not have it just be a book about birth stories or
Mhm.
fertility struggles.
Yes. Yes.
It's really, and not even about just biological family. I mean, there are
Yes.
stories that pretty much anyway, as I mentioned, adoption, fostering, surrogacy, step families,
Mhm.
and
Mhm.
chosen family in many permutations. So
Yes.
this is about the long arc of family life and who
Mhm.
we become from being part of a family and part of a community.
Yes. I love that you're connecting that, not just the meaning of it, but the root cause that
Mm-hmm.
allows it to be sustained. And when we connect deeply with who we
Mhm,
are,
mhm.
it does make a difference. And it gives you the space and the grace to try new things, to create new things, to fail at new things, right? And
Yes,
to keep going,
yes.
which I think resonates with other things you're saying. I
Mhm.
deeply value that perspective.
Thank you. Yeah, and that's why I've enjoyed learning about your work. I think that's something else we should highlight. I mean, the things that we talk about, you and I, they're
Mhm.
difficult topics, right? They're
Yes.
they're and they're things people often want to look away from. And we're like,
Right.
"No, no, no, look over here. This is
Yes.
important." And so
Yes.
I want to emphasize, like your story, these are not sad stories. Held
Right.
Together is not a sad book. It is a
Yes.
fiercely optimistic book. It's
Mhm.
not sugar-coated, but it's really enduring, and that is because it is about the choices that we make, and that's power,
Yes.
and about change. And when we watch people realize how their lives could be better, right? And what the meaning is that they can create. This is about watching people grow, and that always gives hope.
Yes. Yes. And we are a world in desperate need of hope.
So much. And so I mean that brings us also to our work. Like we can't do everything, and
Right.
so it really, if we can step away for a minute and say, okay, even if we can't, we can forgive ourselves for not being
Mhm.
able to do everything.
Mhm.
Doing something that can feel meaningful and that can truly generate meaning and help others create that meaning, like
Yes.
that's kind of all we can do. That's all we've got. That's all any
Right.
of us.
And taking that next best step, right?
Mhm. Yeah,
Like,
I always say that. Like, what's the next right thing?
that's
I
all
mean,
we have to figure out.
yeah,
We paralyze ourselves thinking too far. Uh,
absolutely.
and yes, strategy is important, but like, take that
Mm,
next step.
yeah,
Um,
yeah.
so, as I think about everything we've shared today, the question that's coming up for me, I didn't expect to go here. So humor me for a minute.
It's all right.
I called this show The Authentic Physician. And
Mhm.
the reason I did that, and you may notice I don't wear a white coat in my office.
I don't
I,
either. I
I,
never have pretty much
I,
unless we're fired. Mhm.
right? I
Mhm.
think there's a barrier that's
Mhm.
created in the
Absolutely.
image we portray
Mhm.
and in the even the status implication people are taught to give
Mhm.
a physician. And so the reason I bring that up is because what I want to know to you, authenticity can mean different things. For me, it means showing up and being real with my patients. And,
Mhm.
if my kid
Mhm.
has to be in the office, telling them I'm a mom first and I'll take good care of you, but I've got to care for my kid.
Mhm.
Whatever that looks like for each person, I don't think it's the same. Right. And so
Yeah.
when I say authentic, being an authentic physician, what does that mean to you? How do you
The
show up as an
first
authentic
thing,
physician?
yeah, the very first thing that comes into my mind is about weaving together all those parts of our lives. So you kind of allude to prioritizing. That's
Mhm.
important too,
Yes.
but recognizing that you have all these facets
Mhm.
and any one will rise to the top at a given moment in that
Yes.
role.
Yes.
But how are we fully integrated?
Mhm.
Our personal identity, our professional choices, our family dynamics. How do we weave the parts of our lives together to
Mhm.
create a unified whole that is
Yeah.
still true to ourselves?
Yes. Yes. I love that. With our patients here in St. Louis, we actually have them go through what we call a VIP filter. It's
Hmm.
something acronym because in medicine we love our acronyms, right?
Okay,
But
what's that?
what we do is we sit down with them and we help them understand, yes, we're going to help you with your health, but first let's get a
Mhm,
big picture of who you are, what's your identity, and
mhm,
tell me what your values are. And most people
mhm,
haven't had a chance to actually go through a values worksheet. So we'll use Brene
Yeah.
Brown's work,
Yeah.
and say, look, here's a starting list. Let's
Mhm.
find 10, narrow it down to 5, understand what's important to you. And a lot of there's similarities in words, right? And so,
Mhm.
for example, in my own life, faith, family, fitness, those are the three things I value most. And that's what I'm going to make decisions based on. The I of the VIP filter is for impact. What kind of impact do you want to have? And you alluded to this idea early in our
Mhm.
conversation of I can meet one on one with a family member and that
Yeah.
child, and that's great. And there's glimpses of nice hope, beauty, all the
Mhm.
things, and
Mhm.
yet I can do so much more. It's the same
Right.
reason I left corporate medicine is I didn't want to. I had 3,000 patients, but I saw them for 10-minute visits. I didn't know
Yep.
them, and then
Yep.
by shifting and creating the business I have now, I can spend 30 to 60 minutes with each of them. And so
Mhm.
understanding the impact you want to have, but then that opens up space for new things like conversations here, right? So
Yeah.
the impact changes. And then ending with the P is the priority. How do we prioritize these things in a way that
Mhm.
makes sense to your life and is sustainable for you? So
Mhm.
that's why I was wondering what it means to you because you do have to understand your identity and what's
Mhm.
important in order to make decisions
Mhm.
that you feel are authentic to you and giving people the space to make different decisions. Uh,
Yeah.
I know that we've both known colleagues who criticize patients for doing or not doing a certain test or a certain medication,
Mhm.
but I sense that there's a loss of trust there too of us in the patient to know what's best for
Mhm.
them. If we've done
Mhm.
our job and given them the facts, they don't have to make the
Mhm.
same decision we would have.
Right.
We have to give them the information. Uh,
It takes us a while to learn that in medicine, though.
yes.
We
Why
have to
is
go
that?
well, because we're used to being able to shape the narrative
Mhm.
and control outcomes or at least control the choices, and
Yes.
it's one thing to realize that we can't always do that, but
Mhm.
it's another thing to help the families we work with, the patients we work with to walk through that and
Yes.
acknowledge it and then let them make their own decisions too. It's
Right.
hard, especially if
Right.
we're parents. We're used to having to be responsible for for
Yeah.
people and kind of tell them what to do and hopefully mostly a benevolent way.
Right. Yes. Yes.
Yeah.
I think that's a great insight. And I think that's one of the things I'm at a stage in my life. I wish more patients realized, and I often
Mhm.
find myself these days telling people statins are the big thing in internal medicine. Like patients come in,
Yeah.
I don't want to take a statin. I'm like, so don't take a statin. But let's talk about why you don't want to take it, and let's talk about
Yeah.
what the data says or doesn't say, so you can at least make an
Mhm.
informed decision.
Mhm.
And that wasn't necessarily how I
Yeah.
was trained. I was trained if
Yeah.
you have a certain lab value, ABC equals XYZ,
Algorithm. We learned algorithm.
right?
Yep.
Right. And so I think there is a loss of trust when we approach it
Mhm.
that way. And yet, in defense of our colleagues, I don't
Mm.
know how, when they have 3,000 patients, they can do anything different.
Absolutely.
Right. And
Absolutely.
so,
And
and when they're
yeah.
judged and they're paid based on whether or not they meet a metric on an insurance quality assessment, I don't
Mhm.
understand how we expect a different result. So,
Yeah, yeah, I don't think we can fix that today.
no, that is a totally different conversation for people more qualified than me.
But, your question about sort of how and why, can we let
Mhm.
go of some of that control is essentially what
Yes.
you're getting at, right?
Right.
And that's, that's something we can learn and choose through experience.
Mhm.
We can get a little bit better at maybe, I
Yes.
hope,
Yes.
over
Some
time.
days.
But sometimes maybe it's reinforced if we're parents and we keep doing it
Mhm.
more. But
Mhm.
but I think the other thing at the core of that idea, that question is, you know, as we gain experience in working with others to help them sort out the meanings, the results, all the things, whether medically,
Mhm.
scientifically, or kind of meaning based, like we're talking
Yes.
about. Um, I think we forget how much helping others through these ideas, learning to make this meaning, how much that can teach us about ourselves.
Yes.
And that's just time that you can't impart that onto someone in medical school. Most
Right.
people are not going to have, I certainly wouldn't have had the amount of life experience to be able to
Right.
really do that. And I was in my late 20s. Like I
Mhm.
wasn't a straight through
Right.
college med school person. I was a post back night school person, several years
Yes.
working several jobs. And I didn't have that. I
Right.
mean, even in your late 20s, you don't really have it. Your frontal
Right.
lobe is barely fully cooked at that point.
Yes. Totally true.
So
I
having more patience with ourselves for that and remembering, how much we still have to learn. And we can learn a lot of that by observing others and helping them walk through it. We don't have to
Yeah.
have experienced it all ourselves.
Yes. Yes. Well said. Well, this has been delightful. Thank you
Same,
for
same.
meeting me
Thank
here in this
you.
space and being able to explore it further. I do want to give you an opportunity again and tell us if someone wants to work with you, what does that look like? How can they get a hold of you? How do they get your book? Go through that
Yep.
again.
Everything on the website. So I'll say that one more time. It's RebeccaNThompson.com, and all the ordering options that I mentioned to help support PSI and all of those things, or get a signed copy and support a local small bookstore. But even more so, like, I just really am grateful for anybody who will help spread the word about it. So if you go to the website, you can see all of our reviews and endorsements, different podcasts and television appearances, some live events coming up, and past ones that we've done. And there's a contact form. So feel free to reach out to me. I'm eager to get some new collaborations set up to get these books into medical students and residents' hands, especially, but really all the health professions that I
Mhm.
mentioned. Really, I, all of them would be great. But for now, like, let's start with medical schools and that
Yes.
kind of setup. And
Mhm.
yeah, and book clubs,
Okay.
especially. I've really been enjoying doing some book clubs virtually as well around the country with I mean, this book can be for anyone who wants to learn these stories, but I
Right.
do find a lot of women physicians who have kids at home.
Mhm.
It's a great resource for them. So I'd be
Okay.
happy to do a little Zoom Q&A with book clubs of
Yeah.
like book physician moms, and yeah,
That would
that'd
be
be a lot of
fun.
fun. Enjoyed those a lot. So
Very
please be in
cool.
touch.
Yes. Yes, absolutely. So in our listeners, if there's somebody and you know how to get this book into a medical school decision makers' hands, we need your help.
Mhm.
Help
And just
us to do that.
friends, like, please, these kinds of stories, the way, when we here, I'll grab the copy of the book here, when we designed it, and the artist did such a beautiful job, the cover.
Mhm.
Our vision was, this is a book that you read and you feel like you really are in it. You're just immersed, and someone comes up to you, sees you reading it in a coffee shop or a park bench or carrying it to school drop off, and they say, "What is that you're
Yeah.
reading?"
Yeah.
And you feel compelled to press it into their hands. And
Yes.
metaphorically, that's what I want. I want this book to be pressed into the hands of friend to friend saying, "You
Mhm.
have to read this. This
Right.
story will resonate. This person's
Yes.
chapter." Um,
Yes.
and so anything you can do, tell your friends, gift it to your friends for holidays, and write a
Yes.
review on all the usual places. That'd be amazing.
I love that. So you've heard it. That's what we need to do. Let's help
Thank you.
protect and promote this valuable book and get that out there.
Thank
Any
you.
other last thoughts?
Oh, I think the thing that I would leave everybody with about stories like ours, and especially the stories that we've highlighted and held together, is that the reason they're so compelling is that these are the extraordinary moments in ordinary lives. These things will happen to all of us. We could have
Yes.
walked up to 21 people on the street and created the same kind of book.
Mhm.
And everybody's story is worthy of being
Yes.
told in this way and listened to in this way.
Yes.
So let's keep seeking out those extraordinary moments and helping each other think about what they mean and create meaning out of
Yeah.
them.
I love that. And, really, as we go together and we're vulnerable with each other
Mhm.
and authentic,
Mhm.
and we start to learn from each other and to help each other grow and to pull each other up rather than to push each other down, that
Mhm.
is when trust can begin to reform and to
Absolutely.
grow again and create the world that we all say we want. So let's create it.
Let's.
Thank you for being my guest today. I'm delighted that you were here. I know we have other conversations in the future. So thank you so
Yeah.
much for your time today.
Thank you. This was great. Thank you so much.